This is the PICA and the Patient Experience Network webinar on preparing a successful PENNA entry, which was recorded on Tuesday, the 24th of May. Now, without further ado, I am going to hand over to our panelists to introduce themselves and talk a little bit about PENNA and what they think makes a successful entry. First of all, let me hand over to you, Ruth, from the Patient Experience Network to introduce the national awards.
Wonderful. Thank you, Hanan, and welcome everyone. Really delighted to see you online. Today, my job is really to do a little bit of scene setting and a couple of introductions. And I thought, first of all, for those of you who don't know us, I probably should introduce PEN. So PEN is the Patient Experience Network. We were set up in 2010. We are a not-for-profit. And today you'll be meeting three of the team, and they're on the slides. I'm Ruth Evans, from the Managing Director. We've got Louise, who's Head of Operations, and Helen, who looks after our events and awards. You'll have a chance to meet all three of us through the conversation. PEN was set up really to enable us to focus on what is working well. There's a lot of emphasis on what's not right with the patient experience. And the Patient Experience Network felt that there was a real opportunity and a missed chance to celebrate those things that are working well. So our mission is very simple. We want to recognise, share and celebrate anything that's brilliant in terms of improving the patient experience, with the view of when we've done that, we can then measure, embed and sustain that for ongoing improvement. And really the awards, which is what we're looking at today, the Patient Experience Network National Awards, are our vehicle to do that. So PEN has a range of different products and services, but today it is all about PENNA, the National Awards. And this was when we had one of our last live events before we had to go online, and you can already start to see the energy and the excitement, and really PENNA is very much around celebration, recognition, giving people who are delivering the great experiences the spotlight, their moment of glory, but also a chance to network and a chance to learn and improve. And that's really the essence of the National Network Awards. So they are the only awards that focus on patient experience specifically. The intention, as I said, is to recognise good practice. We recognise good practice through simply entering the awards. So being able to put together a submission and acknowledge the things that you're doing in your organisation is the first step to recognising and celebrating the brilliant things that you're doing. So that is a really important and key part of the process. We then shortlist, and we celebrate all of the shortlisted organisations through case studies. We have a networking event in September this year where everyone gets to come along and showcase their good work. And then, of course, through the process, we're also recognising those that the judges have put at the top of the pile, if you like. So that's really what the awards are all about. And today you are going to hear from our judges and some of the people who have submitted about what successful looks like. And as I said, success in its first state, if you like, is simply putting your pen to paper, your fingers to the keyboard, and actually capturing your good practice. And really, that's all I wanted to cover right now. So I've mentioned who we have. We've been running since 2010. I've mentioned Louise, who'll be joining the panel, and Helen, who'll be probably mainly answering chat. But now I'm going to hand over back to Hanan.
Hi, thank you, Ruth, for giving that introduction. And I'm very going to quickly hand over to Chris, who's going to be going over a little bit about the judging criteria.
I'm off mute now. Hopefully everyone can see my slides and hear me. That will be a good start. And Anne's nodding, so that's a good sign. I'm just going to talk briefly about the judging criteria, having had the pleasure and privilege of being involved in judging PEN for a number of years now. I'm going to just set out the 5 things that we look at and how we score them to give you an idea of what it is that the judges are going to assess your applications on. First of all, before I get into that, I am contractually obligated to tell you a little bit about PICA. As our CEO, I must say these things. First of all, we are a charity. We're based in Oxford. We have a vision of the highest quality person-centred care for all always. And we see patient experience as being a measure of that quality of person-centeredness that we all aspire to. So really the work that we see through PENNA, the examples and the initiatives are fantastic for us. They speak to our mission and our objectives. And I'm always particularly excited when I see them demonstrating the PICA principles of person-centered care in action. That's our framework of the 8 domains of care that matter most to most people when they use services. And there's more information about that on our website. But now onto the actual content. The judging criteria that we use in assessing applications for PEN are these 5 categories down the left: innovation, leadership, outcomes, sustainability, and transferability and dissemination. Each of those criteria gets assessed on a scale of 1 to 100 for every application. So judges will be looking at each of those criteria and trying to work out how strong a proposal is, how strong an initiative is in terms of the evidence that you've supplied. The best possible applications are going to accrue scores of close to 100, and lower scores obviously will be attracted where there's missing evidence or where we're not able to see a clear line between the judging criteria and what you've presented. I'm just going to talk through each of these a little bit. I'm going to try and be quite quick, of course, starting with innovation. And the exam question for judges when we're looking at the applications is the initiative different, innovative, and ambitious? What we want to see are initiatives that are novel and new, ones that stand out from the crowd and differentiate themselves by trying things that might not have been tried elsewhere. Moreover, we want to see them solve a problem in a creative way, and I think it's especially valuable if that's a widespread problem, something that is not necessarily just local, but that could be an issue across other sites, organizations, or care sectors. And that creativity in addressing it can be really, really powerful. I think the key thing that we really want to see here is initiatives that make us think, why have we not seen this before? Why is everyone not doing that already? So it doesn't need to be tremendously complicated. It doesn't need to have years of scientific research behind it. It just needs to be something that finds it a new way to address the problem and makes positive change on the back of that. The second criteria is leadership. And this is about the quality of management and project leadership shown in the initiative. Now, I want to be very clear. This isn't about senior managers. This isn't about having the CEO sign it off or come and speak to it. This is about leadership from everyone at all levels who's involved in the initiative. And what we're looking for in demonstrating that quality of management and project leadership is a clear approach to solving a problem. So I love it when I see proposals that set out in clear terms what the problem to be solved was, how and the solution was worked through, and then how it was planned and executed. That execution can always be a challenge, and we know that it means good communication with stakeholders and beneficiaries. There's seldom a problem in health and social care that you solve on your own. It's about teamwork and it's about bringing people along. So we're really keen to see initiatives that identify their stakeholders, both in terms of colleagues in the health and social care team and patients in the public who might benefit from them, and keep them up to date, either through communicating progress with the project, involving them in co-design or in making decisions, or in getting their feedback to make sure things are working. And that's about that kind of consensus forming approach that exemplifies good leadership. The criteria is about outcomes. Fundamentally, we want to see initiatives that have been effective in solving a problem and that have been properly assessed and shown to be creating meaningful change. Now, there are different ways that you can do that, but we're looking for initiatives that include meaningful performance measures of some type or another. Now, we're not prescriptive about what kind of performance measure might be in place. It doesn't have to be statistical. So it doesn't have to be reams of data showing how things have changed. It could just be really powerful quotes or narrative feedback from people who've benefited from it. Essentially, it's anything that tells the story of how the initiative has led to positive change. We really want that change to affect people's experiences. These are, of course, the Patient Experience Network National Awards. So, It's great if things lead to better clinical quality. It's great if things lead to better safety, or better value for money, etc. But it really has to have that link into people's experiences of care for these awards in particular. So we want to see evidence that speaks to that, and that might involve surveys, comments, written feedback, focus groups, whatever, as long as it tells that story. And we want the outcome measures to relate to the project's aims and objectives as well. So try as much as possible to focus on things that describe the change that has happened and the outcomes that have been reached, rather than just the process that have been implemented. I think it's quite easy to get sucked into describing how much of something has been done rather than what's changed because of it. And really, it's that end state that we want to get to. The fourth criteria is sustainability. And I think you could look at that and assume it was about environmental sustainability. It's not. In this case, it's about longevity. We want to see initiatives that can continue to make a difference over a period of time, that are sustainable in the way they're set up, so they don't involve, a superhuman amount of effort being sustained in a way that can't be managed, but that can make a lasting difference. The absolute best proposals for me are the ones that create natural diffusion of innovation, that allow others to pick up the work that they're doing, and that support the development of colleagues, patients, and services to be able to make positive change over a period of time. Of course, in the NHS in 2022, cost effectiveness is important as well. So I think it's always valuable if you can show that initiatives are economically sustainable, that they're cost effective and deliver value for money. And the final criteria is one that I've hinted at already: transferability and dissemination. This is about projects that can be replicated and that have been well shared. We don't want to jealously guard our secrets in health and social care. We want to be sharing our best practice so that other sites, other organisations and other care settings can learn from them, and so that we can improve together. We're particularly excited to see applications that demonstrate the sharing of learning and the encouragement of best practice elsewhere. And that can be at different stages. It may be that you already have examples where people are using an initiative in other settings. It may be that you just have an approach to communicate it. Either is fine, as long as you're telling us about how you're helping others to pick up the learning from what you've done, so that innovation can spread and scale. And that's it. Those are the 5 criteria that we're looking at: innovation, leadership, outcomes, sustainability, transferability, and dissemination. And if you can demonstrate that your initiative meets each of those boxes, you can expect to accrue a high score. Above all else, I would say make sure that that sense of impact and that focus on person-centeredness is there, and you'll be living the principles and values of the awards. Look forward to receiving your applications. Thank you.
Thank you, Chris. And now I'm going to hand over to another person who has spent a while judging these different entries throughout the years. So, Jean, can you talk a little bit about the entry considerations?
Yes, good afternoon now, isn't it? My name is Jean Tucker and I'm from the Gloucestershire NHS Foundation Trust. Now, I've been both a judge and an applicant, so I can see things from both sides. So I first entered the PENNA Awards in 2017, and after that I became a judge. And it was interesting, once I became a judge, that I actually, looking back, I would have changed some of my entries, because it became clear things I'd missed out that actually were quite important. So when I'm looking at an applicant, the first thing I'm looking at is that it flows well. What I'm reading flows well. It shows the start of the work that you're doing, the work itself, and then the results. And within that, not everything is going to go as you planned, but take that into account and acknowledge that, but show how you recovered from that. The key point should be clear and identifiable. We know what the criteria is, so make sure that you have put your work in highlighting those areas. So if you're saying that your work is innovative, then underline the word innovative, so we know that you're working to the criteria. So I'm not having to look through your work to try to find that evidence of that. Okay. It's also important that the service user or the patient is included in your work. The work is for them, So really they should be with you on the whole journey. So make that very clear that that has happened. Graphs and diagrams are wonderful additions to your project. They can tell us a story on their own. Use them wisely. You've got 3 pieces of information that you can upload onto your application. They can tell us a lot. They're clear to understand, and they can really support your work. So do use those 3 pieces. I think in the end, your project needs to enthuse me as a judge. At the end of your project, I want to be sat here thinking, I really want to bring that into my trust. That's really has enthused me to get on with that work and to contact you and say, tell me a bit more about it. That's the key elements that I'm looking for as a judge. And if you can tick all of those, I think I would score you very highly. Thank you.
Thank you, Jean, for giving us that summary. That's a great introduction to the sorts of things that we are looking for. Enthusiasm being ultimately key here. And I think that hands over very nicely to Kuldeep, who's going to be talking a little bit about creating a winning entry and how to evidence the impact of the work.
Thank you, Hanan. And good afternoon to everyone. So lovely to see so many of you online today. It's really good to see that. I'm Kuldeep Singh, and I'm one of the quality improvement advisors at Birmingham and Solihull Mental Health Foundation Trust. And I've been working in the NHS for about, I think, 16, 17 years, and most of it has been in patient experience. Recently, I shifted over to quality improvement, the QI. But in QI also, EBE involvement, service user involvement is at the heart of everything we do. So it's still that connection there. And whenever we hear about patient experience or we talk about patient experience, that brings a smile to my face. And it's so exciting, and it's just so exciting every time. So I have been involved with the patient experience network, I think right from the beginning, or quite like at the beginning. And I know like Ruth described me as like I was one of the guinea pigs to try out different things, because patient experience, like from my days when I was thinking about like now years and years ago, it used to be just like maybe a survey coming in once a year or something, and that's like what basically described the patient experience. But how we've evolved over the years and how it's come to the mainstream, and it's so up in the agenda and so important. And now we kind of linking it with the staff experience as well. So that's really good. And I think being with the patient experience network has really helped me grow, and it gives you space to like actually exchange ideas with peers and look at like innovation happening, what others are doing, and sharing and adopting things that others have done, and you don't have to do that all over again. So I've been involved with the patient experience network as a judge as well as a participant as well. So I was a kind of a winner overall with my colleague Hashim Abdullah as overall category winner and overall winner as well. So that was back in 2017. But it's such a good experience, and still like stays. It has stayed with us right through the years, and it inspires us every time we look back on it. And whenever we talk about patient experience, it brings all those memories back, how we did stuff. So I'm just going to share those with you now. I know like Chris and Gina's very beautifully described what the judging criteria is when you're judging, and what are kind of things that we look. So I'll take you through a little bit of a journey of how we did it when we did our winning entry back in 2017. So for us, it's all started with the inspiration, the purpose of why we wanted to do this thing, and what was the issue that was there. And it all started when my colleague Hesham, he was a pediatrician, so he was doing his ward rounds, and at one of the bedsides, speaking to a child's mother, and the idea actually popped up there, and she said something about, and that made him think like, oh, why don't we have that in place? So that's how, like, when you're starting up your project, look about telling a story, right? And what was the inspiration of the story, and what's the purpose, and start looking at the outcomes of it as well. So what do you want to achieve once you've done that project or done that initiative or anything else, like any kind of action you're going to take? So I think telling a story is very important. Now, for us, the challenge was how to bring that story to life. So yes, the first point is always the patient voice. And in this case, the carers or the parent voice was quite important. So we went about asking them, okay, so what would you like to happen, or what good looks like to you, what brilliant looks like to you? So how do we go about it? So because from our staff perspective, things that we think, because the main issue in there was something to do with communication. So for us as a go-to place was, oh, let's do another leaflet, or let's do another poster, that'll be great. So, but that wasn't enough. And what we were told by the feedback that we got from the parent was something totally different. And we had to think totally like out of the box and look at like some innovation and try to create something which had a more wider appeal and it could benefit more people. So we set about doing that. So we involved a wider team. So that was quite important. So it wasn't just the project team or what we had together, which was initially quite small, but we involved a wider team. It was a lot of collaboration between different staff groups. That was quite important. Otherwise, there's always a danger of like, it's them who are doing it. It's nothing to do with us kind of thing. That happens quite a lot. So it has nothing to do with bandings. Like in NHS, we talk a lot about banding and stuff. It's nothing. All those hierarchies had to be flattened, and anyone who had an idea could be joining us. So that was quite key when we started off. We made sure we didn't use any jargon. So weasel words was something which we very consciously weeded out, because we tend to use quite like high sounding words, but they actually mean nothing. So we made sure that no weasel words were used. And then we like tested our project kind of drafts with different staff groups and patient and say, okay, fine, this is what we are entering. So what do you guys think of it? And a lot of like initial thing that came up was, yes, that's good, but it looks like quite just soft and fluffy kind of thing. So it's like something. So yes, we had used some coach, we used some patient story in it. That's what brought it to life. But then they said like they need more substance, and that's why we started looking at more data behind it. So we did some analytics and tried to like put some substance behind it. So okay, this is something that's happening, and also to tell us like if we were achieving something or if some improvement was happening, what told us that that's happening, rather than just like someone saying it. That's one thing, that's great, but what's behind it? What evidence do we have in place? So we started looking data over time and saying like, okay, fine, this is what's showing us like something is happening. So these are the changes that are working, or these are the changes that are not working. And that helped us evolve our idea into more concrete and more substantial. Yeah. We also looked at like how we incorporated inclusivity and diversity into our sort of a project, the work that we were doing, and also started looking at how it's going to be sustaining beyond the project. Like it shouldn't be like, say, okay, one solution we come up with. So we started to look at outcomes rather than just one solution for that particular problem. So we went beyond that. So sustainability and how it goes beyond it. So yes, we won the project, like won the awards as well. But what after that? And for us, like funding and resource was a big issue thing. So we said like, how do we address that? So what we put those things in place. So these are kind of things we like did when we were approaching. And of course, we have to stick to the brief of the form as well. So it tells you like certain what it's asking you to do. So you have to stick to that and then put your own story into it. But yeah, it has to be a mix of uh, qualitative and quantitative stuff, and that's quite important, I believe. Yeah. Back to you, Hannah.
Excellent. Thank you so much, Kuldeep, for giving an example of what has happened over the process of building your application, some key points of recommendations that are coming through here. I think that leads very nicely on to Nicola, who's also going to talk about producing a winning entry.
Thank you, and good afternoon, everyone. So my name is Nicola Wayne. I work for Nutricia, which is the healthcare medical division of Danone. And we have a range of medical nutrition items that are available on prescription for patients who can't meet their nutrition needs through diet alone. The division that I work for is called Nutricia Homeward, and we support patients who are being tube fed at home. So we have a team of approximately 160 nurses who look after our patients at home, who provide clinical advice and training and support for them. So my journey with PENNA started quite recently. So I have never met people in the flesh before. So I'm really excited about September to actually physically meet people face to face. So back in 2019, we launched an app that allowed virtual video calls between our nurses and our patients. Now, in the days post-COVID, a video call seems very, very normal and straightforward, but this was pre-COVID. So at the time, it was actually quite innovative. It was pre-FaceTime, pre-Zoom calls, etc. But we had a really nice story, and talking to a colleague of mine, we had some great data. We had piloted this project, we'd launched it, and we had some really insightful patient feedback. And so we started thinking, actually, this is a really nice story, and we could potentially submit this for some awards. And then we found PENNA, and the rest is history, really. So we were really delighted. The first year that we submitted, we actually won 2 awards for our Nutrition Homeward app. And looking at the judges' comments afterwards, I think one of the things that really supported our entry was this storytelling that a lot of people have spoken about. We were able to identify that we had a challenge, we came up with a solution, we measured the impact, but then there was also some really specific elements that we could share with others in order to hopefully inspire others and bring people along and learn from some of the mistakes that we made. What I would say is that being part of the Patient Experience Awards has been really inspirational for me. So me personally, but also us as a business. What we have started to do is really champion and empower our frontline clinicians, so our nurses, who are those the people that are seeing the patients day in and day out, to be real advocates for change and to be really innovative, and obviously they're patient centric, but to really bring that voice to the rest of the organisation. So we've put in place some better communication channels to bring those ideas back into the business. And we have nurse champions now in each region who pilot individual projects. And we also have our own internal awards for our nurses as well. So they could take their local initiatives, bring them into the business, share them, and then we'll take those on board, the winner of the award, and roll it out nationally. One of the awards we were successful with last year had actually come from one of our nurse champions, and it was exactly that. It was a local initiative, a local challenge that she saw with one of her families, initiated very much like Kuldeep said, just with a conversation with somebody, going into somebody's house, seeing that storage was a particular challenge for this family. An initiative was put in place, we piloted it, and then we were able to roll it out nationally. What was really nice about that is it was a triple win. So it was a win for the patients, a win for us as an organisation, but also a win for the environment as well, which I think is also quite nice when you can demonstrate that. So from my perspective, I think it's having a great story, using the data really, really well, and demonstrating how something that is that small, local, initial idea can then grow and have, I think Chris spoke about it before, that sustainability, so that measurable impact. And I think for us, that's what's been key in terms of the last couple of years and our successful award wins. Thank you.
Thank you, Nicola. Some really key tips also added there to the mix. And just to round off the introduction from all of our panelists, I'm going to hand over to Michaela to talk about what judges are looking for in those successful entries.
Thank you. So my name is Michaela and I work in the personalised care team at NHS England, but previously been a patient experience manager in a trust, and throughout all of my jobs, which have been linked to improvements, the patient being the centre is what's driven me. So that's where my heart is. And I guess really that's from a judging point of view, that's what I would be looking at. And, you know, we use that expression, keeping people at the centre, but this is really what this is about. You know, these are patient experience awards. So we've got to make sure that that voice is really coming through. So, you know, that would be the key thing for me. I completely agree with my colleagues. And I think if we start back at the beginning, it's like, you know, Chris went through all of the criteria. I think the first thing to say is, you know, answer the exam question, you know, answer the question that's set out. We've been very clear with the 5 parameters that are being scored on, so that's where you're going to get your points. So make sure you go back and you answer those questions. You know, giving an outline in the context of what you're doing. You don't have to go into vast detail about your geography and, you know, where the trust sits. It's actually looking at, you know, why you needed to make that change, the measurements that you used, but the effect that that's changed had on that person, on that patient, on that family, on that carer. And I think really from the point of the storytelling, the best way to tell that story is to use that emotion and that passion that will come from yourself, but also the people that it's affected. So the the judges what I found out what stood out is when we've really had that patient voice come out, and it's wonderful to see things like the video clips and, you know, when you've got people singing or dancing, but I know not everybody can do that, and sometimes that can be quite hard to do. But, you know, if you've got a quote from somebody about the difference that your change has made, that is what is really going to stand out, really having that patient voice. We've mentioned about no jargon. And I think, you know, that the NHS can be quite bad using jargon, and we've got to remember that, you know, not everybody understands that, and don't make the assumptions just because the judges may work within the health service, we might not understand the context of some of the jargon that you might be using. So I guess to reiterate, really read the question and answer that exam question. Keep your jargon down, really embrace that storytelling element, but bring in the emotion and the passion that you have for what you've done. But let's absolutely make sure that the patient, the carers, the families, the people that change has been made for are absolutely central to what you're sharing with us. Thank you.
Thank you, Michaela. Such a lovely way to round off kind of these introductions here from everybody. We are now going to open the floor. So if you have any questions, do please pop them in the chat. We are following along. However, there are some questions that have already been pre-submitted. So we're going to kick off with some of those. I should note that if it is easier for you to verbally say the question, please do put up your hand and we will get you joining in and open up your microphone for you. But let's kick off with some of those pre-submitted questions. And Louise, this is probably one for you directly. Is it possible to submit a whole system or regional approach to learning from patient experience as opposed to a specific service?
And the answer to that is emphatically yes. It is absolutely possible. The awards are designed to encourage every type of entry from, as you said, that, you know, that the small little thing. I'm thinking about something like Rose Vital Tray, which is a number of years ago, which was a simple tray by the bedside, and also a couple of the brilliant things that Gloucestershire have done. But we always have entries that are much wider spread. So for bigger organisations who are working nationally or regionally, there are key categories that are already set up to encourage across sector working. So for instance, there is a commissioning category for commissioners specifically. So that is, you know, as wide as you can get across regions and areas. We have a category called strengthening the foundation, which is really very, very useful for any organisation or series of organisations. We have partnership working, and there's engaging and championing the public, which are all categories that really lend themselves. But I'll be honest with you, organisations that are looking at much more wider spread initiatives can enter any category. And I was just looking through beforehand at the depth and breadth of these kind of wider initiatives that we've had from places like NHS Wales, from ambulance services, CCGs, private companies, PPL and PEP, NHS Blood and Transplant, and Serious Hazards of Transfusion. All of these organisations are putting in very widespread regional or national initiatives. So look at the categories. As I said, integration and continuity of care is another one, but we specifically have a commissioning category to encourage those wider initiatives.
Excellent. Thank you, Louise. Another practical question has just come in through the chat, so we're going to skip to that. Should we therefore clearly subdivide the written entry into 5 different categories for the judging criteria? Helen's already put a brief response in there, but do you want to expand on that just slightly? Louise? Having a little difficulty unmuting.
Sorry, I thought I'd finished, so I muted myself.
You're very quick off the mark.
The answer for me is no, you don't need to subdivide. There is a summary area where it is useful. So one of the questions is asking you to sort of summarize and put the sort of whole submission into a sort of summary. It's quite useful to do a little bit there. But we talked about storytelling. As long as you go through your submission and answering the questions, you're just picking up on each of those 5 areas. The judges will find them, and I think Jean also said, underline, areas that you particularly want to highlight them to the judges. Anything that makes the looking for what you're trying to tell them easier will really help the judges.
Thanks, Louise. Another practical question here. When submissions involve various teams, do you have any tips on managing input from multiple colleagues to ensure that their collective work is demonstrated effectively? Nicola, I think I'm going to pose that one to you because you've had quite a few projects where there's been multiple teams involved.
Yeah, absolutely. No, thank you. I think the key tip for me would be to make sure that one person leads it and takes accountability. It just seems to make the whole, we've spoken such a lot about storytelling, but it does make that story flow if one person is leading it. What I would say is the very first time that we submitted, we had a little bit of a sign-off process, which I know sounds quite formal, but we had a working document that we were all working on. We'd all make changes, and then once somebody had reviewed it, we'd just put their name at the top, the date that they reviewed it, and were they happy with everything, so that everybody that was involved in the project was enabled and empowered to have a say, but and nobody was left out, and that everybody had contributed, but there was that sign-off process, and that seemed to work really well for us.
I think that's a very handy tip for making sure that everybody's involved and can represent their work there. Another practical question that has come in here, and I'm going to leave this open to the floor. What is your preferred writing presentation style? I suspect this is a bit personal for people. Who would like to jump in first?
Oh, I can have a go at that one. I think I've said somewhere in the chat that plain English is really valuable. So avoiding jargon, writing in an accessible way. I think that it's a truism that that's always a good way to present the story. Beyond that, I would say don't feel too constrained. The important thing is to tell your story in your own voice, because that's the way that the impact is going to be most clear. So don't feel too much like there's a prescribed way of writing or prescribed style. We see applications that are very formal. We see applications that are more informal in how they describe things. Both of them work. We're not evaluating your writing style or your grammar. We're interested in the quality of the ideas and the initiatives that they describe. So it's whatever works best for you. I think you'll often find it's easier to have a kind of coherent, understandable story in a consistent voice if you have one person leading on the writing, even if others are contributing, so that can help. But individual voices is a very individual matter, and there's really no right or wrong.
I think the amount of people on the panel who were nodding along and saying there's no right or wrong answer shows that that's indicative there. This question was repeated a couple of times, and Kuldeep, I think this is a good one to come towards, given what you were talking about the development of your entry. How much data is enough?
Right. I think it's important to have both qualitative and quantitative data. So that's something that has to be or should be included in any of your entries. But the balance is the key. So how much you balance it out, because when you're looking at people who are going to be reading your entries, it's everything that you put in your entry form should be readable, and it should be kind of a layperson should be able to understand. Data is important to evidence your improvement and the changes that you've made, and to show what's happened, what's worked. It's important to do that, but don't go into complex charts and diagrams which no one can understand. But yeah, you can pick up key data figures from it and tell the story behind it. So that narrative should tell you more about what's behind those numbers, if you have to use the key numbers, because numbers and some of the charts can be quite good to display. Okay, in one glance you can see what's happening, but definitely don't go the road of having so many different charts and data tables and everything as well. You have three files you can upload as evidence. So that one of them could be where you put a little bit of a data and a little bit of a charts on it. But yeah, the story behind the narrative is quite important. So it's up to you how you balance that. But yeah, both are quite important, I would say.
Thank you, Kuldeep. This a couple of broader questions here that were pre-submitted. So this is one for the judges. Is there anything that you regularly see overlooked in entries? I think we'll go round the circle here. Who would like to kick off? Go on, Michaela.
I think it goes back to that, answer the exam question, which the only reason I'm saying that is my son's at university doing exams, so that's what I keep saying to him. But it's like, Chris went through everything earlier. If you miss off one of those 5 areas, you are going to miss off a really big chunk of points. And so it's going back and making sure that everything's completed. And something that we sometimes do see is just things that are cut and pasted, and that can sometimes look a bit, it may be a bit lazy. Try and answer each section fully, and again, make sure that you've got that, that patient at the centre.
Very good points, Michaela. Chris, did you have something you also wanted to add?
Yeah, I mean, I would agree with that. I think about person-centeredness has to be key to the whole thing. So if the patient isn't at the center, either in the problem that you're solving, the way you've built out an initiative, or in the impact that you're generating, then that's going to set you back. So you want to make sure that that patient experience is front and center. I think the other thing that I often see missed, though, and that frustrates me, is not giving enough information on the problem to be solved, because our ability to understand the success of an intervention depends on our understanding as judges of the problem in the first place. And it may be that, to you, the problem seems entirely obvious, but bear in mind, this is going to be read and judged by people who have no understanding of your operational context, who don't know the organization you work in, who don't necessarily deal with the same problems. We just need that to be set out really clearly so we can understand what you've sought to achieve and how well you've done it.
One thing I would like to add, Hanan, because I think Nicola and Jean have kind of put that in the chat, is try and get someone not directly involved in the project to read it, because that's where you'll pick up what's missing. So or what if something hasn't been answered. So I just wanted to highlight that in case anybody isn't seeing the chat. I just wanted to highlight that because that's a really good piece of advice in terms of making sure you've got everything covered.
Yes, I think really good advice that was being added into the chat there.
Yeah.
Go on, Jean.
The point I'd like to make is what's often left out that I find is that they've not taken into account how their project is going to be sustainable and how it can be upscaled in order to expand it throughout the organization or for other organizations to take into account. A project that's taken an awful lot of money to put through is going to limit how many people can take on that project.
Thank you. So 4 different areas, some things to consider through there. And probably a similar question, but this was specifically directed at the entrance. Do you have any specific tips for drawing together an entry? Nicola, Kuldeep, do you have anything?
I think my only advice would be to start early. It always takes so much longer than you really anticipate.
I think start early is always the recommendation.
Yeah, and I know that I seriously don't live by that either, but start early. I think it's, again, have that one person who is leading it, but gaining feedback from that wider team, and data is king. Use your data, and just try and make everything as simple and easy to understand as possible.
Yeah, I would add, I agree with Nicola, the things you said, and I would definitely add, take the cat's perspectives as well, because we can see the cats in so many screens. I can see it, and the virtual world, that has been great, the pets and everything. And suddenly I've seen sometimes kids pop into the conversation in the background, and changes the whole dynamics of the room. But yeah, involving, I think planning is really good. and planning, if you can plan well ahead, as Nicola was saying, that's good. So if you have a plan, and that plan can change as you evolve and different things, because what we sort of found was we actually came to know a lot about our project and the work that we're doing when we are actually doing the entry itself, which some of the aspects we didn't think about, which just came into when we, because the form is so structured so well, so you can actually makes you think about, oh gosh, yeah, we never thought about that bit. So it's good to actually follow that, and that can be a really good guide. Plan through it, and I think involving the wider team. So it's not just restricted to yes, one person should be writing the thing, so that consistency of what's written in the form, but do like consult with or involve wider teams as well. In our case, we had to involve like when we were looking at sustainability, to look at like the costs of things. So we got our finance team involved because they had the purse strings and how the project would progress from when it actually is successful. So we involved different sort of a staff group. So that was quite important. But planning is key, definitely.
Thank you both. I wanted to pick up on a couple of questions that have been submitted into the chat that I've already had answers to, but wanted to highlight in case people aren't following along in the chat. One of the questions was, is it possible to read previous winning entries? Is this available? Yes, absolutely. There is a link that has been popped in there for the patientexperiencенetwork.org/awards, and you can see previous entries in there. That website is a complete wealth of the applications that have been previously submitted. Thank you, Helen, for popping it in to the chat once again. There was another question there for a first-time PENNA attendee, PENNA entrant. Do we submit to a specific category? So yes, there are 23 categories available this year, and do have to choose a category on which to submit. But I believe I'm right, and if I was following along in the chat quickly enough, you can submit to multiple categories that are available. So just thinking about which ones you would like to select. I think I want to pose just a quick question to all of our panelists as we're coming towards the end of the hour. And I think this is one that would hopefully help sum up things. What is your final top tip for people who are looking to join the PEN Awards this year, who are looking to enter the PEN Awards? What is a top tip that you would give? Nicola, I think you started with start early. Would that be your top tip?
Start early. I think as well, I think it's really nice when you can demonstrate wins for more than, but for a variety of things. I think in my introduction I spoke about a triple win. So where you can demonstrate that there's been a patient win, a win for the organisation, and then a win for the environment, for example, or a financial benefit. I think where you can demonstrate that triple win is a real success factor.
Excellent. Jean, I think you've got some good tips.
Yeah, my tip would be to use your word count. You have 2,000 words to use, and you can upload 3 pieces of information. Use them all.
Really encouraging the enthusiasm there with the ideas that are coming in. Michaela, I think you were next.
Answer the question.
I think that is going to be the top tip that you need to give everybody, including your son, it looks like. Kuldeep.
Yeah, I would say like definitely use both types of information, qualitative and quantitative. So both have their place. So use both, like and keep the balance between them. And definitely when you're talking about patient experience here, do not forget the staff experience. That's quite important in the whole picture.
No, I think that's a very, very good point. Chris.
Very similar to the points that Nicola and Kuldeep have raised, which is I think the most exciting initiatives are often the ones that succeed on multiple fronts, that demonstrate multiple benefits. So I would encourage you, if you're not familiar with it, to think about the IHI triple aim, or the quadruple aim as it's sometimes now referred, which takes into account patient experience, yes, but also the clinical quality of services, value for money, and in the quadruple aim, staff experience. And I think if you can demonstrate that something is improving or maintaining staff experience as well as patient experience, you're really getting both sides of person-centeredness at once. So that really always resonates for me.
Excellent. Thank you
And
very much. Oh,
just
go on,
I was
Louise.
going to say just a quick last word from me is don't assume. So remember, and we haven't really pushed this a lot, is that the judging panels are made up of a wide variety of people, including patients, clinicians, patient experience people, customer service people, people from all walks of life. Do not assume that they know what you're talking about. So explain nice and clearly and simply.
There's been one final practical question that has just come through on the chat, and Louise, I'm not sure if you or Helen can help with this one. With the file formats for the 3 additional submissions, up to 3 additional, are there any restrictions or limitations? We've talked about they can be in various formats, photos, data that is being submitted. Are there any restrictions or limitations that you're aware of?
The answer is no. We can take information in most formats, but I am just going to quickly call on Helen to just drop some information in the chat. I know she dropped some information in earlier, but if she can drop some more information that you can all see, or even introduce yourself, Helen, and tell us all about it.
Sorry, I had to just go and answer my door. I had a parcel delivered. Yeah, in terms of file formats, pretty much anything goes. The online version of the submission form is via Google, so they pretty much take anything. If for any reason they don't, you can email it to me directly, and we can upload it that way.
Excellent. Thank you, Helen. And I think that's clear that if there is a size limit that comes up through Google, which there sometimes is, if you're putting a number of high files, there are other ways that they can be transferred to the team.
Absolutely.
But just to get in contact with you.
Yeah, they can. If it doesn't come by email, you can WeTransfer. There's lots of different ways to do that.
So do not be limited by the Google form that is being recommended there. So we're coming to the end of our hour together, and I do just want to close up with some additional information about the awards. But I want to first say thank you so much to all of our panelists for joining today. I think we've got a better understanding of the awards, and we've heard a number of really excellent top tips that have been submitted. From the top of my head here, and I do have the difficulty of trying to bring this all together as to what has been discussed. I think for me, one of the things that's really come out is think about the story of your initiative. Answer the questions that are being asked, but think about what the challenges, what the core objectives are, what the proposal, what the impact, and ultimately what the overall sustainability of the project looks like, and explain that in the submission that is being put in there. I probably think also providing evidence of the improvement by measuring both the baseline and also then the change over time is excellent to show that impact. But also the evidence doesn't have to be reams and reams of data, although you may have those available. You might have some statistical graphs that show that. You can also just use qualitative comments, talk about the impact from people's point of view, their words being some of the most powerful things that are available. Some practical tips we've heard, such as using the full 2,000 words to really explain your project, avoiding the jargon, avoiding some cutting and pasting, which Michaela added in there, and answering the question that has been submitted. Those 3 additional supporting documents can include any other information that you think has not already been covered in your application. I think it's a really excellent additional source to really promote your project. Have a think about the entire process, who was involved, what staff were engaged, what patient groups. Really put people at the centre of the proposal that is being submitted. And I want to kind of sign off this close of the summary is that enthusiasm. Really highlight your enthusiasm for the project, and I'm sure it will spill over into the judges as they are reading them. So hopefully that's a brief summary of some of the discussion. I do want to say thank you for joining us today. Just as a reminder, applications are now open. And as Nicola said, you can get a really early kickstart on things that are here. The deadline for all award submissions is the 1st of July. The shortlist of finalists will be announced on the 8th of August. And we're looking forward to seeing you, as was mentioned in the chat there, at the in-person event, one-day award celebration on the 28th of September in Birmingham. Ruth, did you have something that you wanted to add in there? Pop in.
Yes, I just wanted to say, and I think the link's been in there, but I know a lot of people have questions about the nuts and bolts of entering, a lot of which have been covered. But very, very simply, there's a set of 5 steps which are on our website. The link is there, they're here. So have a think about what's the category that you want to enter. If you're not sure, call us, we're more than happy to help. Register with us, because then that opens up everything. You get the form that you can circulate, you get the support that we can offer, and you're kind of booked into our system. So we're keeping an eye on you, and we know if we haven't heard from you and we need perhaps to give you a quick follow-up call. Make sure that you know the judging criteria. We've spent a bit of time on it here. And then there's an offline form that you can tinker with, you can share, you can circulate, you can take into team meetings. That form's yours to craft and create your stories as you want. And then when you're ready, you can cut and paste that up onto the online form, or you can use the online form. The choice is yours. So I just wanted to give you a little bit more colour to those steps. Really, I think the key is, if you're interested, then just register, and we'll be there to support you. You're on our radar then, so we know that we need to look after you, basically.
And I do just want to highlight that at the bottom of that page, there are contact details for the team at the Patient Experience Network, a phone number and email address, so that you're able to get that support if you need some help with the submission. Okay, so I think we're drawing to a close. I do want to say that today's recording will be shared on the PICA website, a link of which will be circulated after this event. And I just want to say one final thank you to all of our panelists for joining us today and sharing their insight on the PEN Awards. We really do appreciate you spending the time to go through these top tips with us all. And I just want to say thank you again to our audience, and we hope that you have a lovely rest of the week. Thank you all for attending.